Many PAs and NPs are venturing out into social media, and my next guest is no exception. She is a PA who has her own podcast. She's going to tell us more about the podcast and the topics that she covers, but we're also going to dive in and talk about that question. Is choosing a medical specialty the most important thing to help you have a fulfilled and satisfying career? And if choosing the right specialty isn't the most important factor, then what are the factors that you should look for in order to give you the kind of career and life that you want? She has a lot of great information to share that can help you in your practice. So I hope you stay tuned. Hi, Tracy. Welcome to the Medicine Couch. It is so great to have you here today. Why don't you tell us a little bit about yourself?
Awesome. Well, hello, Michelle. Thank you so much for having me. My name is Tracy Bingaman. I am a PA for 11 years. I am a wife and a mom and an entrepreneur. I do so many things, but I'm really excited to dive into some of these topics today. So thanks for having me.
We're going to be talking about something that I love, which is choosing your medical specialty. So before we dive into talking about medical specialties, though, you mentioned that you're an entrepreneur. What kind of business or businesses are you running?
So I have a podcast called The PA is In, where I share all about content for PAs. We talk about burnout and boundaries and some really great things that are PA or medical provider specific. And I help PAs to work through burnout, through one-on-one coaching, and also to navigate job changes. And I also offer negotiation consultations.
So tell us a little bit more, though, about your clinical path. I'd love to hear what you have done in medicine since graduating.
Certainly. So I am a surgery PA through and through. I thought I wanted to do family medicine until I walked into the operating room, and then I never wanted to leave. So I started my career in general surgery. I did some bariatrics, some orthopedics, so subspecialties as they needed me. Then I started to feel like I wanted to sort of stretch my wings and try something new. So I transitioned to an inpatient position in robotic urology. And then now I do private plastic surgery. So I do a lot of aesthetics, Botox filler, and I do outpatient only. I miss the operating room, but I also really love being home for dinner.
When you were talking about your experiences earlier, it brings to mind, like, is there a right specialty? Like you said that you went into the operating room and you never wanted to leave. Do you think it is important for people to identify a specialty that they're going to work in, and that that is what's going to determine whether they have a successful and happy career or not?
I think probably yes and no. So I think it's important to feel passionate about and interested in the work that you're doing. That being said, I think any of us can look at all of the specialties available to us and say, there's a certain realm of these specialties that are interesting to me and that I could see myself being passionate about. I personally have found in my career in medicine and in talking to a lot of guests on the show and just colleagues in general that the culture of where you work is probably way more important than the specialty, which is a huge shift in thinking. But my experience has been when I find a job and a group or a department or an office that aligns with my values, that really sees patient care as something that's super important, that also values boundaries and getting out of work on time, or making sure we're expediting certain things for certain patients. When my values line up with my group or my office, it makes for much more smooth sailing than when we're at odds with each other.
And I think it's funny too that so many times people go into thinking, oh, I'm going to PA school or whatever, thinking this is the specialty I'm going to work in. I am definitely going to, work in emergency medicine. And then they go through rotations and they end up working in women's health or something, like they totally did. Do you get that a lot when you interview people?
Yeah, I mean, I think the idea that this path to career success and fulfillment is linear leads us astray. So I decided I wanted to be a PA when I was 16 years old. And based on a shadowing experience in high school at a family practice office, because that's where I went to the provider. I shadowed my PA who took care of me in the family practice office. I said, I want to do primary care. And it's interesting because now looking back, I can see the reason that I wanted to do primary care, the thing that was attractive to me about family medicine, was that I got to know patients over time, so that I got to see them and see them back and see their kids and see, multiple generations of a family, and that they were my patients over time. I now do Botox and filler, which is pretty much as far from family medicine as you can get on the spectrum of what I take care of and what I do on a daily basis. I don't do a lot of medical management. I do a ton of procedures, but I see my patients every 3 months because Botox only lasts 3 months. So when I'm doing a neuromodulator on a patient, they get amazing results. They're super happy. Their wrinkles are gone. And then they're going to come back in 3 months. So I get to see, how was the wedding? How was the graduation? How were things with this patient? And they're mine, right? If they're like, who's your injector? They're like, Tracy is my injector. They are mine. I am theirs. We have this relationship that we cultivate over time. They're vulnerable with me about their insecurities. I speak into their life in a way that is just like, I can build them up. I can help them to feel better about themselves. And all of that is what I liked about family medicine in a completely different application. So if there has been something that you were like, oh, I thought I wanted to do emergency medicine, maybe you thought you wanted to do emergency medicine because while you were there, you saw some really interesting women's health, right? So it could be sort of teasing out what you thought you wanted to do and the way that it manifests as a part of your career. The other thing is we anchor early. And then later when an opportunity comes along, we're like, well, that doesn't really fit me. That doesn't really fit what I was expecting. I would encourage you to keep an open mind when opportunities come along and not to limit yourself based on your experience or even things that have been interesting to you in the past, because you never know what you're going to end up doing that could be fulfilling.
I have talked to so many people who just kind of fell into a position because maybe they were in a smaller market or they were just having trouble finding what they wanted and they just thought they'd take this as a placeholder type thing. And it ended up being something that they just loved, absolutely fell in love with. So definitely keep your mind open. But I also love what you said about identifying that there may be aspects of the job that is really what is appealing to you. Are there other aspects like that that you've thought about that people don't put enough importance on when they're looking at a position? Like what other things would you tell them to look at to help them evaluate if this position is right for them? That's beyond whether what specialty it's in.
Well, for me, the schedule is probably more important than the specialty. And I think that goes along a little bit with like the culture and the values. So I have 5 kids, 3 of whom are super young. 2 are like older, college, high school, and 3 are super little. So for me during this season, getting home for dinner is a priority. Getting out on time matters to me. So even if I were to go back to a position at a hospital where I was working shifts, like whatever it was, I had figured out like the time between 5 and 8 p.m. for me is the 3 most important hours of my day. The morning is rushed. We're getting kids to school. I'm getting to work. It's crazy. The afternoon, getting out of work by 5 and being home by 5:30, that defines success for me. And having enough energy and presence of mind to be able to, during those 3 hours, be present. Because when I was super overworked and overwhelmed and burned out, there were days where I was home by dinner, but I was so exhausted and overwhelmed that I wasn't present and I wasn't the person that I wanted to be and showing up for the people in my life who, if you had asked me, I would have said, these people matter more than work, but I wasn't really showing up in that way. So I think it's important to sort of back into what your definition of success is. So my definition of success when I was a brand new graduate is a lot different than what my definition of success is during this season of my life. So if you can define like, hey, a successful career for me is one that doesn't encroach on my personal life, or it's one that pays me lots of money, right? Like you can decide what success looks like for you and then hold up jobs and say, would this align with what I want my life to look like and feel like? Whatever it is that you need, the job should fit your life. Your life should not be crammed in around the job. We get that wrong a lot.
So say you've thought about it and what you've identified what those important things are in your life. And like you said, it's different based on what season of life you're in. Then you have a job opportunity. How do you evaluate if that position is really going to fit your needs? Because sometimes it's hard to tell until you get into it, right?
So I'm a huge proponent of working interviews, getting in there, getting your boots on the ground. If you want to call it shadowing, great. At my current practice, I had left the place that had burned me out. I was actually a 1099 employee, a contractor for this group. And they had said, hey, we might be interested in bringing you on in this aesthetic capacity. And I said, great. I wasn't working. I kept my kids in daycare and I just kept showing up at their office with permission. I didn't like go, like checked with the physicians and I said, like, hey, can I come shadow? So I would go in, I would see, the injectable patients with the provider, and I would look at the schedule, right? I would see, what time they arrived at the office, what time they left at the office. I really did a deep dive on like, how do I feel about this? And for me, for that, it was like the schedule was great, right? The schedule was going to work, but I had to reconcile the fact that previously I had been an inpatient based high acuity provider with a massive census and people in the ICU, and the ER was calling and I was going to the OR and I was doing procedures. My day was not planned at all. I was flying by the seat of my pants. I was triaging everyone, to the fact that I was then sitting in an office at one computer and I was going to have a schedule of patients in one room where no one tried to die. Right. So this was like, nothing was urgent, nothing was emergent, everything was elective, everything was cosmetic. It was like, I was like, this is like a whole different universe. And I had to ask myself, like, how does this feel? And even after I took the job, it was probably 6 months of me decompressing from adrenaline and emergencies until I sort of settled into, this is the new normal, this is my clinic. And just sort of like, how did that feel? How did it feel for me? And ultimately, you sometimes have to guess. So sometimes you have, as much information as you can. You talk to people that used to work there, you talk to people that currently work there, you spend as much time getting as many questions answered as you can. And then you say, to the best of your ability, I think this is worth a try, or I think I'm going to pass on this. And you never know. And you never know for sure. But you have to let go of that like right answer, wrong answer mentality and decide, I'm going to do what I think is best for me now and not care what other people think about it. No specialties are more worthwhile or less worthwhile or more cool or more real or less real. That all of those patients need care.
I also love what you said about doing the shadowing or working interviews, you called it. I think when you're younger and inexperienced, you just look at kind of like what cases you're seeing and stuff. When you've had some experience and you understand the world of medicine, you can really look at it with a much more critical eye and decide, would I be working with staff that get along with each other, that have some good systems in place, that are efficient and hardworking but friendly? Am I going to be working with other providers that are supportive and that lean on each other and talk about things, or is everybody off in their own little world? And then how does the administration and the office work? Is there a lot of pressure coming from administration, or do they treat their providers with respect?
I can tell you, I've never taken a job and said, wow, in this process, I asked way too many questions, right? It's almost always that I wish I had asked about things. And I wish I had asked questions without fear of what they were going to think of me. So I have these young kids, ear infections exist, right? Like viruses and bacteria are part of our lives. They're at daycare, like licking other children right now. They are going to get sick. It is part of having young kids. And both my husband and I work. And so sometimes that means one of us has to call off, right? In order to take a kid to the doctor to get an ear infection diagnosed. And so I wish every job that I had taken that I had asked, how do you handle call outs? Like, how is that received? Like, I wish I had asked administration how they logistically handle it, where those patients go, who their reschedules go to. I wish I would have asked other providers, like, are they good about it? Like, do they make you feel badly when you're sick or a family member's sick? But when you're interviewing, you don't want to ask that question because, like, then they'll know, right? Then they'll know that you're a human. Then they'll know that you have young children. Then they'll know that you might call out. They already know you're a human, right? They already know these things are going to happen. So you might as well ask the question, how do you guys handle last minute reschedules? How do you handle paid time off? Is it hard to get time off approved? All of these questions that like you don't want to ask because you're like, well, then they're going to know I'm going to take my time off. That's okay. It's okay that they know
Yeah.
that. Asking more questions cannot hurt. We ask 2 questions when we should ask 20, and that is information that will help us to make that decision.
I love what you said. Don't be afraid to ask those questions and don't be afraid to show who you are, because it's just like in dating, right? If you don't show them who you really are and you're not learning who they really are, then there's a good chance that relationship's not going to work in the future, right?
Yeah. And if you can approach this with an abundance mindset, like there's always another job, like there's always somewhere else I can get hired. This job wants me. Do I want them? Have they earned the ability for me to work there? Do I want to give them 40, 45, 50 hours a week in exchange for the amount that they're planning to compensate me? Does that feel good? Because otherwise, you can get a different job. Like it doesn't have to be that one.
Totally. And that, of course, that's also harder when you're newer, in your career. You just out of school and you've got loans to pay and things. But test the waters, see what's out there. Don't be afraid, like you said, to ask for what you want and what you think that you're worth. And realize that even as a new graduate, you have a lot of worth to these companies.
Yeah, as a new graduate, the only time that you're not making them as much money as someone with 25 years of experience is when you're orienting, because you're going to have the same schedule template as all the other advanced practitioners in that group. So, and insurance companies don't pay by years of experience. They pay by what you bill. So you are probably, if you're a new grad, if you're newer to a specialty, you're probably discounting yourself way more than that administrator, because that administrator knows the kind of revenue that you're going to generate for the practice.
All right. So, say that you have identified this job. Any advice for starting that position that is going to set you up for success in the future?
So, anytime you start a new position, whether it's within the same organization or a new one, it's a super great opportunity to evaluate your boundaries. I think, especially when we start a new job or when we're a new graduate, we're more eager to prove ourselves. I think as PAs, we have this little chip on our shoulder that we need to prove ourselves as a profession, and that has bled down into the way that we show up at work. So we are likely to raise our hands for extra shifts or call or, covering someone's in basket when they're out. And we do that from a place of eagerness and wanting to help and wanting to be valuable and wanting to take care of patients. But I would encourage you to sort of pump the brakes on volunteering for new things and focus on building effective, clear boundaries, right? So maybe that's, I don't chart at home. I don't bring charting home. I don't bring my laptop home, or I don't check email on the weekends, right? I can check when I'm in next time on a shift. So when we build these boundaries, what we're doing is we're training other people how to treat us. It's easier to build the boundaries on the front end than it is to have terrible boundaries and then suddenly say, I'm not going to take work home. I'm not going to check email on the weekends. So can you build your template, build your schedule, sort of establish the fact that you're not going to be answering emails all night long, and make sure that the patients that you're seeing during the day, you have the ability to chart on them? Because a 15-minute visit for a follow-up, which we have all had on our schedule, is barely time for that patient to like get in the room, get vitals, for you to say, hi, Mr. Smith, how are you feeling? And then do your exam. And then what often is left, you have to do that when Mr. Smith is in the office, and then he leaves, and then you go to see the next patient. But that note isn't done. And when the note isn't done, at the end of the day, you have however many notes remaining. So making sure that for your experience and efficiency, your template is built in a way that you have the ability to see and chart on your patients in whatever block that feels good. So whether it's a 2 or 3 hour block in the morning or a block in the afternoon, that you have the ability to chart as you go, to chart before lunch, to chart before you leave the office, whatever workflow works for you. It's not your job to take that work home. And we're bad at raising our hand and saying, I'm not going to see this many patients. I can't. I won't, because I want to take better care of my patients. So if you can just right out of the gate, start slowly, ramp up slowly, start with 1 patient an hour, chart on them, whatever the administration will sort of let you do, be less eager to do more, be less of that achiever, hold yourself back. And it's going to be a conscious effort because you're already thinking about the committee you can join, the way that you can improve office efficiency, how to teach the nurses something new. Like, I get it, you're excited, but pump the brakes and take care of you and get those boundaries in place, because then once you're efficient and established, you can fill in with other things.
Yeah. Do you ever, when you start a new position, do you ever like just sit down with your MA and kind of talk through workflows and come up with a system of how you and your MA are going to work together, or do you or not? Or do you feel like the system's already in place and you just kind of adapt as you go?
For the most part, when I was an outpatient, I was stepping into an established practice. At my practice now, we didn't have an MA in our department until recently. So we had this experience of having someone who had worked in our office get onboarded into our department and saying, hey, here's our expectation. Here are the things that we want you to do with every patient every time. Here's the information we need from you after you've roomed them from a medical history standpoint. And I think we historically let these things fester, right? So, like, say you step into a system and you have some MAs that have been there for longer than you have and are maybe more experienced than you are, but you need them to do something because the way that they've been doing things isn't effective or safe or reasonable, or you just have a different practice pattern than the provider that they used to work with. We are more likely to turn away from that MA to colleagues and say, like, it's so ridiculous. They never get me what I need. They're not doing it right. As opposed to turning to the person who can actually change this outcome and say, hey, super grateful for your help. I'm really glad you're on our team. I think you're such an asset and patients are lucky to have you. I need you to do this, right? Like, I need you to do something differently than you've been doing. Let's start it today with the next patient that you room. Let's check in a week and see how it's going. How is it affecting your workflow? Do you feel like it's working? Do you need help and support from me? As opposed to just saying, like, I need their pulse, right? Like, I need, whatever it is that you
Right.
need, like, this is what I need from you. Like, making sure that you say that you're grateful for the work that they're doing before that. And then here's how we're going to follow up. Here's how we're going to know if we're on track with this or not. Because just saying to the MA, I need this from you without any plan for check-in or follow-up, like, why do they care if you're not saying, I'm going to hold you accountable, we're going to check in then, communicating it up the chain of command with them if it's a necessary thing. If it's a minor change, you guys can probably handle it. But if it's a massive thing that you need them to do, like, maybe their manager needs to be involved. Maybe your manager needs to be involved. And that's depending, situation to situation, how your office is set up.
You have given us some amazing information. I think probably a lot of it has come through the experiences that you've had on your podcast, learning from other PAs and all that they've gone through. What kind of topics? Tell us more about. Do you address these kind of topics, and what other things do you talk about on your podcast?
Sure. So the podcast is called The PA is In. I talk about PA specific issues. So things like burnout and boundaries, self-care and wellness. We talk about financial wellness, pretty much anything that I have stubbed my toe on along the way, things that I have seen my colleagues struggling with, things that people email me questions about.
If people want to hear more from you, tell people how they find the podcast.
Yeah. So if you search The PA is In on iTunes or YouTube or anywhere that you get your podcasts, it will pop up. I am on LinkedIn. So Tracy Bingaman, I share a lot of information on LinkedIn. And I'm also on Instagram at Mrs. Tracy Bingaman.
Well, thank you so much again for joining us today. And thank you for all you do to help providers.
Thanks. It's been a pleasure. Thanks for having me.
If you are a provider working in a specialty and you want to change to another specialty, but not sure how, or if you're a provider that's still looking for what medical specialty you might enjoy, then you can watch these videos here, or you also can go to the playlist on my main channel page. Thank you so much for joining me today. Take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.